we are already aware of DNA, and most of the DNA happens to be nuclear DNA. Our genetic transmission is mostly due to nuclear DNA. But you have to remember that we have got a very important component of the cell, the mitochondria. And mitochondria happen to be called the powerhouse of the cell. And mitochondria itself has a DNA, which we call as mitochondrial DNA. And this mitochondrial DNA has got a huge significance scientifically. But students, they are not much concerned about science, they are much concerned about examination. And NEET PG students would be wondering why I have taken mitochondrial DNA today. Assured that many questions have been asked and many questions would be asked in future. So I need your undivided attention for this topic. Now, mitochondrial DNA, you have to remember that there are certain important facts which distinguish it from the nuclear DNA. Number one thing is that the mitochondrial DNA is small. And once it is small, there is something else as well, that the mitochondrial DNA does not have introns. The mitochondrial DNA is exclusively composed of exons. And you know that there are so many things which can cause mutation. And once there's a mutation in the mitochondrial DNA, it would invariably strike the exon. There would be no repair because of the absence of introns. So the mutation rates in mitochondrial DNA are far, far higher. And once there is a mutation in mitochondrial DNA, the escape is very low. The chances of having an abnormality due to mutation in mitochondrial DNA would be high. And it has been found that the mutation rates in mitochondrial DNA are 10 times higher than the nuclear DNA. Now, in addition to this, you have to remember that where are the mitochondria present? The mitochondria would be more present in active tissues where you need to have active metabolism going on because they are the powerhouse of the cell. And basically, mitochondria are also abundant in highly active cells, and they are concerned with a very important biochemical process, the oxidative phosphorylation. So any mitochondrial defect would be also called as OXPHOS defect or mitochondriopathy. So now we take up the mitochondriopathies. But before that, I would just let you know that the mitochondrial DNA, as far as its shape is concerned, it is circular and closed DNA. Now, what is the clinical outcome of mitochondrial mutations? They're asked. And number one disease we have as a result of mitochondrial mutation is the Leber's hereditary optic neuropathy. Now, second important disease is what we call as MELAS, myoclonic epilepsy, and lactic acidosis in combination with strokes. Number third would be the individual myopathies, selected myopathies as a result of mitochondriopathy. Then we have got this MERF syndrome, myoclonic epilepsy with red ragged fibers. We also have this NARP syndrome. What is neuropathy, ataxia, and retinitis pigmentosa combination? We also have this Pearson syndrome, which is a combined defect of exocrine pancreatic defect plus sidereoblastic anemia along with neuropathy. So you can see that highly active and metabolic tissues like the brain, like the heart, like the skeletal muscle, like the kidney and the liver would be affected in mitochondriopathies because these tissues are highly active metabolically, I mean to say. So that is why in MELAS, in MERV syndrome, in NARP, you will be finding the most of the diseases to these organ systems. I hope you remember the mitochondriopathies, especially the Leber's hereditary optic neuropathy, the MELAS, the MERV syndrome, the NARP syndrome, and the Pearson syndrome as a result of mitochondriopathy. I hope you find this small information beneficial for your exams. Wish you good luck. Thanks a lot.